Modifier 59, distinct procedural services. When the procedure is distinct from the another one, in that cases we have to give 59 modifier. For the distinct procedural services used when the additional or separate were performed in the same visit or different site. Example is a patient undergoes the two procedure in the same visit. uh, First is remove of the skin lesion and second was the excision of the cyst on the different side. In that cases we have to give CPT for the lesion removal and cyst excision with the modifier 59. The keyword are additional services, separate procedure, different site, which is the unbundle and distinct services. 62 modifier for the two surgeon. When the surgery is provided by the two surgeon, in that cases we have to give 62 modifier. When the two surgeons work together as a primary surgeon, each performing a distinct of the part of the procedure during the same operation session. Okay, when two different surgeons performing the two different surgery, in that cases we have to give 62 modifier. Example is a complex heart surgery. When cardiac surgeon is performing the heart wall repair and thoracic surgeon performing the lung surgery, in that cases we have to give two different CPT code, okay, with the modifier 62. Keyword are co-surgeon, shared procedure with the joint surgery, separate but concurrent role. Next is modifier 63 for the procedure on the infant who's having the less weight than the 4 kg. The procedure is performed on the infant weighing the less than the 4 kg. In that cases, the procedure is increased with the complexity and effort due to small size and affecting the technique. In that case we have to give 63 modifier. For example, a neonatal circumcision on the infant weighing the 3 kg, we have to build the CPT code with the modifier 63 to show the infant weight is less than 4 kg. Keyword are neonate, newborn, low birth weight, increased complexity, small size patient. Modifier 63 for the surgical team. When the three or more surgeons are performing the same surgery, in that cases we have to give the 66 modifier for the team of surgeon. When the complex organ transplant is done, for example kidney transplant is done, one surgeon is removing the diseased kidney, another is preparing the amputation. Okay, so in that cases we have to give the CPT code with the modifier 60C to indicate the procedure by the team surgeon. Keywords are surgical team, working together, complex procedure, joint effort or transplant surgery. The modifier 76, repeat procedure by the same MD. When the procedure is repeated by the same physician, we have to give 76 modifier. Okay, and that should be the same encounter means same day. Example is first EKG is performed. For the first EKG we have the code, and for the second EKG we have to give 76 for the repeated procedure. With the modifier 76 we can indicate that the procedure is repeated. Keyword are repeated again same day, same physician, repeated services, follow-up test and medical necessity. Next is 77 modifier for the repeat procedure by the another MD. When the same day the another provider is giving the services or performing any procedure, in that cases we have to use 77 modifier to indicate the different physician on the same day. For example, morning first EKG is performed and initial interpretation has the questionable finding. The afternoon second physician reviewing the EKG for the second opinion. In that cases we have to give the modifier 7. Keyword are repeated by the another physician, second opinion, different provider, same day, medical necessity. These are the keyword to identify the modifier 77. 78 for the unplanned return to OR. Previously we discussed in modifier 58, that is the return to OR. Okay, return to OR. So that is for the plan, and here unplanned return to OR means 78. Okay, one more thing. Uh, when patient is coming for the unrelated ENM service, we have modifier 24. Okay, so don't get confused with the modifier. Please understand carefully and read carefully to judge the modifier. When the unplanned return to OR room for the same physician or other QHP professional. So in the related procedure during the post-operative period, okay, we have to give unplanned return to OR. Example is given: laparoscopic cholecystotomy, gallbladder remove. The patient develops bile duct injury, requires the unplanned return to OR. In that cases, we have to give initial CPT as well, initial surgery plus the second one a repeat CPT with the modifier 78 to indicate the unplanned return to OR. The keyword are unplanned return to OR, related procedure, post-operative complication, same physician or emergency reoperation. Modifier 79, procedure during the post-operative period. Okay, when unrelated procedure or service by the same physician given, in that cases we have to give 79 modifier for the unrelated procedure. Okay, unrelated ENM is different, unrelated procedure is different. So don't get confused with the modifier. In the post-operative period, if another surgery is done, another procedure is done, in that cases we have to give 79 modifier. Here is a note given: for the repeat procedure on the same day we have modifier 76. So that's why I am saying you please understand carefully and read carefully in the question. Initial surgery: the patient has the knee surgery and enters the 90 days of global period, which is for the major surgery. And unrelated procedure: the patient developed the new skin infection on his arm, which is unrelated condition. Same physician performed the minor procedure. Okay, so procedure is different. In the post-operative care, we have to give modifier 79 with the initial surgery, and the second one we have to give modifier 79 for. And this modifier always goes with the second surgery because that is the unplanned. Okay, unrelated, not related to, different condition, separate procedure or separate physician, post-operative period, diagnostic during the global period. Next one is 80, assistant surgeon. When the main surgeon is performing the surgery and the another surgeon is giving just assistant, in that cases we have to give 80 modifier. For example, primary surgeon is there and assistant surgeon is there, so we have to give two different code. For the primary surgeon we have to give single code, and with the assistant surgeon we have to add the modifier 80 to indicate that the surgeon is just giving the assistant. The keyword are surgical assistant, second surgeon, co-surgeon exists at the surgery or global period. Next is 81 modifier, minimal assistant surgeon. When the assistant is given but it is a minimum, in that cases we have to give 80 modifier for the limited assistance. Keyword are the minimum assistance, limited task, specific and specific assistance. Modifier 82, assistant surgeon. When the resident is not there, in that cases we have to give 82 modifier. When the resident surgeon is not available, in that cases the non-resident surgeon is assisting the surgeon, in that cases we have to give 82 modifier. Okay, and in this case also we have to give 2 CPT code, and the second one we have to give the 82 modifier to represent the assistant surgeon. Okay, the keyword are no qualified resident available, non-resident assistant, the second surgeon, surgical assistant, missing resident. Modifier 90, refers outside laboratory. When the outside laboratory are referred to perform the lab test, in that cases we have to go 90 modifier. So keyword are outside lab, referred out, external laboratory, third party lab or reference lab. Next is modifier 91, repeat clinical diagnosis test. When the test is repeated, in that cases we have to give the 91 modifier, and that repeat test should be on the same day or same encounter. Okay, use when the test is performed more than once on the same day on the same patient. Okay, when not to use the 91 modifier due to some technical part, okay, some technical issue of the instrument, in that cases we are not giving the 91 modifier.